Hello, everyone. I'm sorry not to be joining you live this evening, but here in Bangladesh, we're 6 hours ahead of the UK, and it's now the early hours of the morning, or it will be when you're watching this. And I have a busy day planned for tomorrow, so I'll be having an early night. So thank goodness for the wonders of technology that allow me to join you virtually. First, a huge thank you to Sue for inviting me to participate this evening. So let me introduce myself. I am Joy Kemp. I'm a midwife from the UK working with UNFPA, the United Nations Sexual and Reproductive Health Agency in Bangladesh. I joined UNFPA in July this year. Prior to that, I was working with the Royal College of Midwives in the UK as the Global Professional Advisor, managing the RCM's global health partnerships in Bangladesh, Cambodia, Nepal, and Uganda. You might be familiar with our textbook, Global Midwifery, Principles, Policy and Practice, which I co-authored a couple of years ago with Dr. Gaynor McLean and Nesta Moyo. So I can't miss this opportunity just to express my deep sense of loss and sadness, having received the news this week that Gaynor had recently passed away following a period of ill health. I first heard about Gaynor when I was a student midwife. At that stage, she was working with WHO, the World Health Organization, designing the first Safe Motherhood modules. And I remember my tutor telling me about that work and how important that would be for midwives around the world. Gaynor worked with us at the RCM as a consultant, helping to shape the international strategy and writing some e-learning resources for us on global midwifery. And her book, Tiger Stripes and Tears, and a series of articles that she wrote for the British Journal of Midwifery really helped midwives working internationally to carefully consider their role and reflect on how their approach could either help or hinder the efforts of midwives in other countries and contexts. So I hugely admired Gaynor's creative approach to teaching, learning, and sharing knowledge. She designed several games for midwives, including one on the partogram and one called Why Did Mrs. X Die?, to help midwives understand care in labour and causes of maternal mortality. And during the COVID-19 pandemic, when I moved into care for my dying father, I moved into my parents' house to care for my dying father at the same time as our publisher was waiting for us to submit the manuscript for our book. I will never forget how Gaynor stepped in to write some of the chapters that I was supposed to write and keep us on track to meet the publisher's deadline. Gaynor will be hugely missed by her family, especially her twin sister Sheila, and her many friends and colleagues, and also by me. So on to our work here in Bangladesh. This is my team on my first day. UNFPA is supporting the government of Bangladesh to introduce midwifery as a profession separate from nursing. And much has already been achieved by our amazing national team and a few fantastic international midwifery specialists. It's an honour and a privilege to have joined this team. It has been a challenging end to the year, with a general election planned in Bangladesh for January and much political unrest just now, which interrupts our programmes and prevents us from travelling around the countries to implement our activities. But still, this team is achieving amazing things, and I was delighted last week to join in the annual general meeting of the Bangladesh Midwifery Society and to see how the new generation of young midwives are stepping into leadership and raising their voices to ensure the enabling environment they need to provide high quality midwifery-led care to every woman in Bangladesh. So looking forward to next year, we have a new partnership with the International Confederation of Midwives to continue supporting the fledgling Midwifery Society. We're working with 2 Swedish universities to develop the new generation of midwife teachers and to ensure the quality of midwifery education. And we're supporting the 400 plus humanitarian midwives who are providing midwifery care to the 1 million Rohingya refugees in Bangladesh. And we're continuing to work with the government of Bangladesh to build the professional framework for midwifery, advocating for the rapid deployment of the 20,000 plus midwives that are needed in the health workforce here to provide comprehensive sexual and reproductive health for every woman and her family. I'm travelling back to the UK for Christmas and the New Year, but I look forward to all that 2024 holds for strengthening midwifery in Bangladesh. Thanks very much for having me. And here is my email if you'd like to know more about our work here. And I'll wish you all good night. Thank you.